Hi, my name is Don Merriman, school psychologist in the North Salem Central School District in North Salem, New York. I've been asked to talk to you today about multi-tiered systems of support, specifically for social, emotional, and behavioral functioning. Specifically, I want to talk to you about cognitive behavior therapy, sometimes referred to as cognitive therapy, and how that can be integrated into an MTSS model within a school system. Cognitive behavior therapy is really kind of lends itself to this multi-tiered system of support because at its base is a conceptual understanding of how all humans think and function. So the cognitive model is based on the idea that our emotions and behaviors are influenced by our perceptions of events. So cognitive theory tells us that it is not the situation itself that determines what we feel, but rather it is the way we think about that situation. Thoughts that go through our mind are automatic and can cause us to have different emotional responses. These automatic thoughts reflect the way in which we interpret and think about a situation and have a major effect on the way we feel. Now, we also know that all of us make mistakes in our thinking, and that can lead to difficulties in terms of anxiety, depression, being prone to anger and angry outbursts. So the cognitive model also teaches us how to identify and watch out for those mistakes in thinking, and also to be aware and mindful and watch out for just negative self-talk in general that can drive these emotions. So within a school setting, we can, at a Tier 1 level, teach all students about the cognitive model, how it works, how it operates, and teach students about both this concept of thoughts lead to feelings and behaviors, and that it's not the event itself that causes the reaction. We can also teach them to be aware of those thoughts and watch out for those thinking errors that we may make, and then to do some change, some action in order to shift that thought for that particular situation. At a Tier 1 level, we can work with whole classes and teach them some of those underlying principles of CBT that will help equip them to handle situations, be more resilient and function better. Some kind of pre-packaged programs that might help us do that would include Incredible Flexible You, which is now referred to as We Thinkers. It's a great program, particularly for younger students. We can also use a program known as Go Strengths for our older students, later elementary school, middle school, and even high school. Currently in the North Salem School District, we're using, at the elementary level, we're using We Thinkers for kindergarten and first grade, and we're using Go Strengths for third, fourth, and fifth. At a Tier 2 level, we can begin to work with students on a more individual basis, be that in small groups or in one-to-one counseling sessions where we use a more specific CBT approach, specific meaning specific to the difficulties that they're having. There's a number of really high-quality treatment manuals out there, particularly for the novice cognitive behavior therapist who needs some guidance and direction. The caution being that you really need to have a good case conceptualization and understand what the target is. Those resources are available on the NYASP website. Number of high quality treatment manuals to help guide the school psychologist in delivering those services. At a Tier 3 level, we look to increase the intensity of that intervention to help those students that are having more difficulty or are not responding to a smaller dose of the treatment. So to summarize, cognitive behavior therapy can be readily integrated into a multi-tiered system of support within a school setting. It's highly effective, evidence-based interventions. For more resources, check out the NYASP website. You can also contact me. My email address is dmerriman@northsalemschools.org. As far as training, there's a number now of online training resources available, and there's also a number of training centers in the Northeast. The Beck Institute would be one of the most recognizable. They have been great about coming to school districts and providing training in the foundations of cognitive therapy within a school setting. A great way to get that training in a less expensive way is to combine efforts of school districts and bring them in to do a training that is shared amongst several districts. For more information about how to do that, again, feel free to contact me, and I'm happy to guide you. So I hope this brief overview of CBT and how it could be used in a multi-tiered system of support is helpful. And check out the NYASP website or reach out to me for more support. Thanks.